Hello, my name is Alexandra Morel. I'm a general dentist in Plano, Texas, Smiles by Morel. And the reason that we're here today, I will be showing you how to adjust an anterior crown after you print it digitally. Before I start, I'm a CEREC doctor, okay? So I print a lot of things digitally and then I adjust them by hand. Before I start, I want to show you a couple of pictures. So the reason that we do what we do is because we have patients come in. This is a patient that came in yesterday in the afternoon around 1:30 p.m. My staff has scheduled her and she comes in and she says, "Make me look beautiful. I know you're a same day dentist, and Dr. Morel, I know I love you." And she talks me up and I look at her case and I say, okay, how in the world am I going to do this in one day? Ideally, I would want to have a wax up and take a look and see how things would look in the patient's mouth and transfer it into her mouth before I start anything like this, because it's a very complicated case. Look at this lateral and the shape of it. I actually have 3 teeth instead of 4 teeth. I have this gap. She would like to close this gap. My midline is completely off in this case. I cannot show you her face yet. Hopefully I will later once I get the release, but this midline is completely off. This would not be a midline. So right now she's centering here. Her midline is actually somewhere around here. Well, I come to find out she's not too concerned about her midline. She's pretty much concerned about closing as many gaps as possible. She wants to look better. She wants to feel more confident. And I have decided to do a composite mock-up, meaning trying to adjust things chair side so I can later on buy a copy in my CEREC software and give her a very close or precise replica. So this is my mock-up. So I basically have chair side, used composite materials and created this. She was super happy, super excited. I told her to go home and wear it. She says, "What about same day dentistry? Can you have it done for me today?" What I have here, I closed her gap. I tried to center her teeth. Now that I'm looking at the photographs, I'm thinking I could have actually added a little bit more on this side and maybe this corner can go up a little bit. But here is what's going to happen. She's going to come back for me next week on Thursday. And if she loves this, I will change absolutely nothing. I will buy a copy her, which I have already actually pre-buy a copied the case in my CEREC software. I will buy a copy this case and I will get these teeth out exactly the way they are if she loves it. And then I will finish it by hand to close all of the little imperfections. One thing, see right here, because I have such a wide diastema, this is a very difficult case to close. What I will do when I'm prepping, I have to go about a millimeter subgingivally to be able to have a really nice contour and close the diastema where I will not have this little box as I'm working on this patient.